Hello, Dementia Matters podcast listeners. Thank you for returning to the podcast during this COVID-19 pandemic. I know you have a lot on your mind, and despite being at home, I know life is not easy. It's an understatement to say we are living in an extraordinary time, but whatever you want to call this ongoing experience, it is asking extraordinary things of us. And life doesn't just stop because of it, which is why this podcast continues. I want to pivot here on Dementia Matters and address important issues affecting those with cognitive impairment and those without during this COVID-19 coronavirus pandemic. I cannot cover all the issues and frankly shouldn't. I encourage you to go to trusted sources for specific information, such as the U.S. Centers for Disease Control and Prevention, your state and local health department websites, and the Alzheimer's Association. You can also find resources on our website at adrc.wisc.edu. That's adrc.wisc.edu, and that of the Wisconsin Alzheimer's Institute at wai.wisc.edu. For other interesting and important stories on the COVID-19 pandemic, I would recommend my colleague at UW Health, Dr. Jonathan Kohler of the Surgery Set podcast, who has a special series called The Front Lines of COVID. We will include these links to all these resources in our show notes. For those of you affected by Alzheimer's disease or any cause of cognitive impairment, you know better than anyone that it takes a community to care for those affected and to work on the front lines of treatment, prevention, and cure. What we face with COVID-19 is no different. We all are needed in this fight, and I thank you for whatever it is that you're doing. Take care and be safe. Well, welcome back, Dr. Walaszek, to part 2 of Dementia Matters. Let me thank you again for doing the interview and for doing part 1 where we covered isolation. Today, I'm hoping to talk with you about the anxiety and stress that can happen during the time of this COVID-19 pandemic, and hopefully hear from you different coping mechanisms or suggestions on how we can address this. So thank you for being here.
Absolutely. My pleasure. Glad to be back.
So I guess to start with, can you explain the difference between a clinical anxiety disorder, such as generalized anxiety disorder, from something like fear or worry?
Absolutely. That's a great way to start. And it's, what's important about this is thinking about what is our normal human experience versus something that might represent a problem and cause some distress or cause some problems with day-to-day living. So on the one hand, fear is completely normal. It's a way of appreciating the stress in the environment and actually kind of organizing what's our response going to be. Folks may remember from school kind of the flight or fight response. It's a little more complicated now. It's fight or flight or freeze. So animals have different ways of responding to threats in the environment. So you can run away, you can fight back, or actually pretty commonly is to just freeze. If you make yourself small and not moving, then maybe that threatening thing out there isn't going to get you. So we have been finely tuned over millions of years to respond to those kinds of stressors. We have adrenaline that starts coursing when there's a stressful thing in the environment. Our pupils dilate, our muscles tense to get ready for action. We start mobilizing glucose or sugar so that we can respond. So there's this whole cascade of events that's normal. That's what we've evolved to respond to stress in that way. And so that's why, as you tiptoe closer to the edge of a cliff, your heart rate might start skyrocketing, or you might start sweating, or, you stand in front of a crowd of 100 people at a wedding to give a toast. Your palms get sweaty and your mouth gets dry and all that. These are stressful situations, and you're having a normal response to that situation. So we don't think that that's pathological or needs any treatment. We just recognize that we are human beings, we're mammals, we're animals. That's how we respond to these stressful situations. Now, when that becomes excessive and causes a lot of distress, or like you can't function from day to day, you can't go to work, or can't pay your bills, or can't take your medications, or can't take care of your household, or whatever it is, because the anxiety levels are so high, that crosses over then into something like generalized anxiety disorder, which is a condition where people worry all the time and trying to push those worries out aren't successful. People feel tense, they don't sleep well, their stomach hurts, their head hurts, they may be irritable. So that kind of whole cluster of symptoms plus problems with day-to-day living and distress is generalized anxiety disorder. And there are other anxiety disorders out there too, like panic disorder and so on. But the dividing line is really how much distress is this causing, and is it causing problems with day-to-day living?
Okay, and that last part is I think a really key thing, because there is a lot of fear and worry right now because of the COVID-19 pandemic. And I'm just wondering, how does one know if that current feeling is problematic or simply just understandable given the circumstances we all are facing right now?
It's a great question. I mean, I think we're all in this uh, high level of stress and anxiety with, new news every single day about the pandemic and new directions about what to do, and uncertainty too. Should I wear a mask in public or not? Perhaps by the time this airs, we'll know the answer to that. But right now, there's still some confusion about that. So uncertainty leads to fear and anxiety as well. If you don't know what the right thing to do is, or what's going to be the outcome if I do X or Y, that leads to some uncertainty as well. So I would, to answer your question, I would kind of fall back on, well, what's the impact this is having on your day-to-day life? If you're still able to carry on with day-to-day life despite these stressors, then probably what you're experiencing is a normal stress response to all this. But if things are starting to kind of break down in day-to-day life, falling behind on tasks, affecting relationships, that would be another big thing. So if the stress is leading to irritability that's causing a lot of relationship problems, that'd be a source of concern. I think we'll touch later on depression, but if the anxiety is leading to some depression and hopelessness, and certainly like any suicidal thinking, or wishing that one were dead, that's when the alarm bells should be going off, that this is not a normal reaction. I need help.
It seems to me that based on your last two responses, one of the most important things for us to do is really acknowledge how we're feeling, acknowledge the worry or the fear or the sadness, and then kind of take a step back and take a look at it to see if it's reasonable or not. And even if it is, whether we can control it or not, really move on from there.
Yeah, I completely agree. I think that kind of self-reflection is really important in stressful situations. It helps with resilience. It helps with coping. And just as a bit of a tangent, I was looking at a paper that looked at the relationship between wisdom and loneliness. And we probably don't have an official definition of wisdom, but it's probably some combination of knowing stuff, but also being able to self-reflect, being able to take other people's perspectives and kind of understand where they're coming from. It's probably having some sense of like higher purpose and even spirituality. So folks who measured higher on wisdom, whatever, however you measure that, they were less prone to loneliness. And I don't think it's a huge leap to say that they might also be less prone to having trouble with anxiety and depression. And so cultivating that ability to self-reflect is really important. And it's also a critical part of a lot of practices like mindfulness or meditation practices. Are about reflection. Spiritual and religious practices are often about that as well. Sort of stepping back, looking at the big picture, the larger meaning of things is really important. When people lose that capacity for self-reflection, that's where we can see some struggles with depression and anxiety. And then in our interventions and how we help people with depression and anxiety, we will promote some of that ability to name emotions, to recognize emotions, and to not let the emotions get the better of us. To sort of know, yep, that's there. I'm feeling stressed right now. So what am I going to do about that?
In our prior episode, you also spoke about social media and potentially getting misinformation or bad information. And that probably be something that we could avoid if we're feeling particularly stressed or anxious, I suppose.
Absolutely. I mean, I think one of the challenges now is just how hard it is to figure out, like, well, what is the right thing to do? And just how big of a deal is this virus? And of course, it is a very big deal. But there are competing sources of information about this. And so, part one is what are reliable sources of information? So I think of things like the government's CDC website or cdc.gov as a really good jumping off point. And then, things like social media are probably a little more mixed in terms of just how reliable those sources are. And any source, no matter how good it is, you really want to take it in moderation. So turning those things off, and maybe even just rationing. Here's how much news I'm going to take in today. I'm going to, for 20 minutes, tune in to whatever, or go to cdc.gov or whatever it might be, and just that's my portion for the day. And then I'm going to turn it off, and then I'm going to focus on other things like my relationships or exercise or reading a good book or whatever the other things might be that are beneficial.
Something that you didn't mention, which I know about you from talking to you earlier, is that you have cats. And so pet therapy or just enjoying the presence of your pet, what do you think about that as far as our person's well-being and addressing stress?
Well, I'm very biased as the owner of, well, I guess my family would chastise me for saying owner, perhaps parent, or better yet, servant to two cats. I mean, I think pets are, it doesn't have to be cats, obviously. It could be dogs or hamsters or chinchillas or whatever. I think, pets are critical. They're, I mean, especially cats and dogs, but other creatures, they have emotions too, and I think they can be in tune with us as well, and so, and the value of touch, that's something that we're going to miss out on quite a bit while we're all in lockdown. The less hugging, less other social interactions. You can still pick up and hug your cat or, rub your dog's tummy or whatever it is you do. You can still do all that stuff. And touch is incredibly important for our well-being. So absolutely. And if you don't have a pet, so there are websites galore of various feeds online of videos of different animals, and there are all these delightful videos of like the animals being let loose in the aquariums right now, for example. And so that can be really kind of heartwarming stuff as well. So even if you don't have a pet, those are much more positive, good for emotional health kinds of things to watch online or on TV.
Some of the questions that I've been getting in clinic are, what can people do about the worry or stress that they're feeling right before bed, and that stress is getting in the way of their sleeping? And I've been asking them to write in a journal things that they're appreciative of or things that they're grateful for or that they just simply enjoy, and to reflect on that. So I guess I'm wondering, from your professional opinion and personal opinion, what do you think of gratitude journals?
It's a wonderful idea. It sort of belongs to a school of thought called positive psychology. In other words, what are the things that you can actively do to work on your emotional well-being? And gratitude is a great exercise for that. It's free. It doesn't cost you anything to say thank you to someone or to write down, a common strategy people do is think of 3 things that you are grateful for today, and make note of it or write it down or say it to someone or whatever. And I think especially if the gratitude is about a person, I may be grateful for the banana bread that's in front of me, but I should probably be more grateful to my family member who baked the banana bread and brought it to me. So that I think it's a really powerful personal and interpersonal experience to kind of share that gratitude. So I think it's a great idea. I don't know that you have to do it like every night. I think it could be like one of multiple different strategies that you have. Certainly, other things like turning off the TV or turning off the internet, well before bedtime, to try to promote that kind of getting into the nighttime routine is important. Not drinking alcohol right before bedtime. I think the temptation is, oh my goodness, I'm really stressed. I need to wind down. I'm going to have some wine or beer or whatever. It doesn't really work. It's actually counterproductive because it may affect sleep. It may affect balance. It may affect memory. So not a terribly good idea. So, kind of scheduling things that are kind of calmer and, more emotionally healthy in those 1 to 2 hours before bedtime, I think is a great idea to promote some good sleep.
Now, what recommendations do you have for people with a clinical diagnosis of anxiety disorder or depression who feel they're no longer stable because of their pandemic? And before you answer that, I just want our listeners to know that this is not formal clinical treatment recommendations. I guess I'm just asking you, Dr. Walaszek, just from your experience, what things that you might mention or recommend in a very general sense.
Absolutely. It's a great question. We know that, many of us suffer from anxiety disorders, from depression, from other conditions. And a time of stress like this it's a time of risk for people with anxiety disorders and depression and other conditions. So we definitely want to be on the lookout for, maybe the condition had been stable and now it's starting to get worse again because the person is fretting and not sleeping well and kind of starting to spiral somewhat. So one is just monitoring and just recognizing, okay, how am I feeling? Am I feeling different than I have been before? Am I starting to have struggles in my day-to-day life or in my relationships with people? Two is reaching out and getting help. So if you have an established relationship with a therapist, a psychiatrist, primary care doctor, whoever it is, with whom you talk about your mental health, reaching out to that person and letting them know that you're having a harder time and seeing if they have any recommendations for you. Especially being mindful of any suicidal thoughts. So that's a particular concern, certainly for people under stress, if they have anxiety disorders or depression, and especially if you're kind of lonely and isolated, that can start to be an issue as well. There were studies after another epidemic called the SARS epidemic, SARS epidemic, in 2003, that rates of suicide went up. They went up kind of immediately afterward, and then as long as 1 year out, the suicide rates were higher. And it was thought that, and that was especially true in older adults. And so it was thought that some of the isolation, some of the fear, some of the worry that, am I going to be a burden on my family? Those things kind of drove the suicidal thinking. So that's a red alert, alarm bell, 911 kind of situation. If you're developing thoughts of suicide or your loved one is developing thoughts of suicide, stop what you're doing, call 911, or if you call your doctor, call someone, let them know that's going on, because that's something we need to address so that this pandemic doesn't take yet more lives.
And I think that's a really important point to emphasize, is that even though we are in our homes and we are social distancing and in essence isolated, you're not alone. The healthcare system is still there for you. And then when you're having those concerning symptoms, there are people on the other end, whether it's the phone or telemedicine or the ER, that can help you.
Absolutely. And I would also, we've been focusing on, anxiety a lot, and I kind of touched on depression, but that's another big one. And it ties into another normal human experience. So, sadness. So, we all get sad. That's just a normal thing. We get some bad news, or we lose someone or something doesn't quite meet our expectations. You may get sad. And so that's totally normal. Grief is also normal. And, unfortunately, there may be a lot more grief in the coming months. So, recognizing those signs of grief, and again, unfortunately, a lot of the normal things that we do with grief, like reach out to each other, have a ceremony, have a funeral, remind ourselves about our social ties. That's going to be difficult in the coming weeks and months with some of the restrictions related to the pandemic. So, we may have to turn to things like more, online memorials or other ways of still having those rituals that are really important to us. Going to religious services through some sort of online or other format. Those are going to be really important to help us with the normal grieving process. So that's all normal stuff. It can turn into depression. So a clinical depression is where someone is sad most of the time, and it's affecting their relationships, it's affecting their day-to-day functioning, and may lead to some suicidal thinking as well. So in addition to anxiety, depression is going to end up being a big issue during the pandemic.
And there will be help, though. There are people like yourself, as well as psychologists and therapists and counselors who are also at home or at work who eventually will be able to help people.
Absolutely. And, it's an interesting thing that's happening in kind of the delivery of mental health care that I think folks should be aware of. Most of us have very rapidly switched over to either telephone or video interactions with our patients. And it's been remarkable because it's a way to stay in touch, even though a person can't come into the clinic. We can still stay in touch by phone or video, and so those mental health services are available. And so if you are struggling, reach out. You may not be able to see in person your therapist or other doctor or clinician, but there are other ways to connect, like by phone and by video.
Well, and to end our interview today, Dr. Walaszek, I guess I would like to ask a question for our listeners with cognitive changes, whether it's mild cognitive impairment or dementia. Do you have any specific recommendations for them or their caregivers as they are also feeling quite anxious and stressed about the pandemic?
Absolutely. I think there's significant benefits to be had from trying to maintain social ties as much as possible. So, there's going to be there'll be less people coming into the home, for example, to help out. There'll be less ability to go out to social gatherings. So, trying to maintain as much as possible, whether it's by phone or video or whatever other means. Trying to maintain social ties as much as possible. So that's true both for the folks with MCI or dementia and for their caregivers, because the caregivers are going to need that relationship support, that emotional support as well. I think we touched on this earlier and in episode 1. The value of routine and trying to kind of maintain normal routine as much as possible, and maybe even find some new routines, some things that you didn't have time for before. Maybe again with television or the internet or radio or other resources, finding some new things to add to one's routine, in addition to all the other self-care things that we've talked about earlier.
Well, that's wonderful information. And for those that are on the website, we'll also have Dr. Walaszek's part 1 there as well. And I guess with that, Dr. Walaszek, thank you for being on Dementia Matters and doing these 2 interviews for us.
Absolutely. And I really appreciate your attention to this issue. First and foremost, with the pandemic, we have to save folks' lives from the virus, from the infection, do everything we can. But at the same time, and very soon thereafter, we'll have to be thinking about kind of the psychological consequences of all this. And so, I'm really glad you're getting folks thinking about what we can do to help folks out psychologically.
Well, we do anticipate having you on in the future, so be ready for that, Dr. Walaszek.
Thank you. Look forward to it.
Please subscribe to Dementia Matters on Apple Podcasts, Spotify, Podbean, or wherever you get your podcasts. And rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center. The Wisconsin Alzheimer's Disease Research Center combines academic, clinical, and research expertise from the University of Wisconsin School of Medicine and Public Health and the Geriatric Research, Education, and Clinical Center of the William S. Middleton Memorial Veterans Hospital in Madison, Wisconsin. It receives funding from private university, state, and national sources, including a grant from the National Institutes of Health for Alzheimer's Disease Centers. This episode was produced by Bonnie Nutkinson and edited by Bashir Adine. Our musical jingle is Organisms by Chad Crouch. Check out our website at adrc.wisc.edu. That's adrc.wisc.edu. You can also follow us on Twitter and Facebook. If you have any questions or comments, please email us at dementiamatters@medicine.wisc.edu. That's dementiamatters@medicine.wisc.edu. Thanks for listening.